Welcome back. President Cyril Ramaphosa has called an urgent meeting of the National Coronavirus Command Council to discuss the latest developments in the devastating second wave of the COVID-19 pandemic that has gripped the country. The meeting tomorrow morning comes as the death toll from the pandemic has reached the 30,000 mark, while record daily infections continue unabated.
South Africa and the whole world under the grip of an unrelenting, deadly enemy. Against this background, talk of a wonder drug to fight COVID has sparked great interest among medical practitioners and even politicians. The National Freedom Party's Member of Parliament, Sheikh Imam, has sent a lawyer's letter to Health Minister Dr. Mkize and the South African Health Products Regulatory Authority, threatening to take them to court for not allowing the manufacture and distribution of ivermectin in the country.
This wonder drug received the Nobel Peace Prize in 2015. It is regarded as one of the safest drugs you can ever find. Extensive research and trials are taking place currently, all yielding positive results to fight COVID-19. I've attempted to contact all the departments, including SEPRA, but to no avail. Now, you will agree with me that this is a matter of extreme urgency because people are dying. 500 people on average on a daily basis. 17,000 are being infected on average on a daily basis. There is no solution in sight. The vaccines are only expected in the second quarter if we do receive it. Minister has already alluded to the fact that we have limited resources. He has not ordered the goods yet. We haven't decided on who the preferred service provider is going to be. But what is important is this, that this so-called wonder drug called ivermectin has been tried and tested and has been proven in more than 83% of the cases to be positive.
Last month, the South African Health Products Regulatory Authority came out strongly against the use of ivermectin to fight COVID, citing lack of evidence that it is safe for human consumption.
Ivermectin is not indicated nor approved by SABC for use in humans. There is no confirmed data available on ivermectin as yet for its use in the management of COVID-19 infections.
But the regulator has since received and reviewed new data about the drug. It says it will now allow it and will tomorrow publish guidelines for how it should be taken. Meanwhile, the Institute of Race Relations has added its voice to those criticizing government's vaccine rollout plan.
Attorneys acting for the Institute of Race Relations today sent a letter to the Minister of Health regarding the procurement of COVID-19 vaccines for South Africans. The IRR's legal representatives will similarly further be approaching all MECs for health and the heads of major hospitals and health insurers to gather vital information relating to the following questions. What is the exact timeframe for the procurement of COVID-19 vaccines? What are the target dates for the 3 phases identified by the Ministry of Health for vaccine introduction? Regarding the various steps to procure vaccines, how many vaccines will be procured for each phase and which vaccines are being considered?
President Ramaphosa is expected to announce later this week what new measures, if any, government plans to take in response to the latest escalation of COVID-19 infections and deaths in the country. Mbongeni Mushwa, SABC News, Johannesburg.
To talk a little bit more about this, Dr. Martin Gill is an ENT or ear, nose and throat surgeon. He joins us now. A very good evening to you and thank you so much for joining us, Dr. Gill. I mean, from what we've heard, this is ivermectin won a Nobel Prize in 2015 and it's said to have been proven as highly potent for its antiviral and anti-inflammatory properties in laboratory studies. But it's been used for animals, according to what I know. Is that all that's been used for thus far? Just give us a little bit more of what you've learned of it.
To Lisa and your viewers. There's been a lot of literature that's just recently come into the play here, and it's all showing very, very positive things about ivermectin. So ivermectin has been used in humans for more than 35 years, and 3.7 billion doses have been taken already. So it's been shown to be exceptionally safe. It was used for the treatment of parasites mainly, so tropical diseases. It's since been found to be effective against certain viruses, and one of them is the SARS-CoV-2. And that was, we first noticed that when a study was done in Brisbane, where they showed a 5,000-fold reduction in viral load over 48 hours. And what that showed us is that the ivermectin actually does kill the virus. And the latest studies have subsequently showed it not only kills the virus, it stops the virus from getting into the cells. And then the most important thing, which you mentioned, was that it stops the inflammatory process that happens around this disease and quells the cytokine storm. So it's quite a remarkable medication in that it works across all the different phases of the disease, including as a prophylactic. So if you take it on a bi-weekly basis, it's very unlikely that you're going to catch the disease.
Dr. Gill, I understand, and this is what SAPRA itself has said, that up until now, before it's received recent reviews, not enough was known about it. And I believe you yourself have only just recently been introduced to it and its properties. So just tell us a little bit more about how you learnt about it and its so-called efficacy, because we are yet to do some of those studies here.
Yes, okay. Well, I've actually been using it right from the beginning of the pandemic. So I've been keeping track with most of them, but they're different studies for different phases of the disease. So there's a whole group of studies as a prophylaxis, and every single one of them is positive. Then there's a group of studies showing how effective it is in the early stages when you're still at home, and it's almost, if you catch it early, and that's the key to it, virtually no one dies. And then in the hospital, the World Health Organization review has shown about an 82 to 83% improvement in survival, so a reduction in mortality, which is quite remarkable. There's no other drug that does that.
So then why the, and I won't say resistance, but why the caution by SAPRA? I know, as they've said, that they have at least learned about the controlled clinical trials and the information that's come to them from multiple centers and countries worldwide. So they are reviewing that. But what would be the reason for concern? Just looking at its, medical makeup, what is in it that would be of concern?
There's nothing. It's just such a safe drug, and it's such a clever drug. The problem that SAPRA had was when they did their original assessment, there were only the early trials available, and they were not really that well done, and there were not enough patients in it for them to, at that stage, say this was a safe thing to do. So, and even the World Health Organization at that point hadn't okayed it for the treatment of COVID-19. So I know their job is basically to keep us safe, and I know they use the World Health Organization as a guideline as to where they should be going. And just recently, a whole lot of new studies have come out, and they were assessed, and it was still felt there were not enough patients in those studies. But in the next 2 or 3 weeks, three very big studies are going to come out, which will get us to that point where there are enough patients to start saying this is a drug that we must be using.
So you have said pretty much that you recommend it from your experience and what you've seen out of the people. But talk to us as an ENT. Are there possibilities of contraindications, and what could those be? We've been told that the coronavirus pretty much hides around the sinusitis cavity area. So what could be possible dangers or contraindications?
Okay, from an ENT point of view, there are not really any contraindications, but the main contraindications are they're not sure how safe it is in children under the age of 15 kilograms. So children under 15 kilograms shouldn't readily be given it, and then obviously pregnant mothers or lactating mothers, because they've got babies in their tummy. So those are and all of these are that we think may be safe, because there have been a few people who have inadvertently taken it and nothing's happened. And then there are a few medications like blood thinners that we need to be careful with, because it makes them and can cause you to bleed. But other than that, it is probably one of the safest medications that we know. So my advice is, if we do get it, that anyone with a medical condition must consult a doctor before taking it.
Okay. And are there people who would be susceptible to having a negative reaction to it? Because, I mean, like the vaccine, we're told that they also still don't know what the side effects are. So I'd imagine that the same applies with this, given that it's never been used to treat COVID-19 before. And with the complication of the second variant of the virus, you know, are there people who would probably be in more danger, who we've spoken about comorbidities, and as you say, people should consult their doctor, but, you know, just help me speculate here.
I really don't think there's going to be a problem. 3.7 billion people have taken it, and that will be people with all sorts of conditions, and there's been no serious complications. The main complications that they were seeing originally with this was an allergic reaction to the dying parasites. So that was simply treated with antihistamines. And I think that's still a problem. I mean, a lot of people are going to take it and kill their parasites with the first dose. So we might see a bit of that. There's a parasite called lower, which some people react really badly to, and it can cause almost fatal reaction. But we don't get it here in South Africa. So I don't think we're at risk to that either. And other than that, it's not affecting receptors in our body that are going to cause a problem. The receptors that it affects are found in invertebrates, which are the worms and parasites, but we don't have those ones. And I think that's why it has so little effect when we take it.
All right, thank you so much for speaking to us and your insights. Dr. Martin Gill is an ENT surgeon, of course. We'll speak about this from a pharmaceutical standpoint at 8 p.m.